So having an operation can be pretty scary, and what we're going to do is have you meet some of the people you're going to be dealing with as you go through your operative experience at Crouse Hospital in Syracuse, New York. We're going to meet some people in the Recovery Care Center up on the 5th floor, which is where you're going to go before the operation and after. We're going to then go to the pre-op holding area, where we're going to meet one of our nurses. Then you go to the operating room, which we will introduce you to some people there in another video, the next video. After the operating room, you're going to go to the recovery room, where you meet one of our recovery nurses. And finally, after that, you're going to go back to the Recovery Care Center for your post-operative management, and that's where you're going to go home from. So let's talk about each of those places and start meeting some people from those places. So first we're going to go to the Recovery Care Center at Crouse Hospital, where you're going to meet our nurses. They'll get you changed out of your street clothes. They'll probably start an IV to give you some medicine and some IV fluid. And speaking of medicine, we have Julia with a tip about medicine. Here we go. We're at RCC in Crouse, and Julia's got a tip for us.
Yes, when the patients come in, please don't bring your medications. We don't want any accidents like double dosing. Sometimes patient will sneak and take their medicine, and the nurses give them medicine too. Wow, an accident.
Now sometimes people have other health issues that they bring to the hospital with them. A very common one is for people to have diabetes. And we have Emily here with a very important pointer for those of us who are coming to the hospital with our diabetes. So we got Emily here who's going to give us a tip.
If you are a diabetic and you are on insulin and you have a sliding scale at home, please bring it with you, because we will not be able to adjust your doses appropriately after surgery. Thanks.
So now we're going to go to the pre-operative holding area. Which is right by the operating room, where you're going to meet our anesthesia doctors and their team. They have a very important job. The first job is to put you to sleep, which is really important, and the second job is to wake you up, which is actually more important when you think about it. So you're going to meet those guys, and then you're also going to meet our OR nurse, who's kind of the air boss in the whole affair. She's going to be the one who's keeping overall track of everything and making sure that you stay safe. And as a matter of fact, we have a really good OR nurse for you to talk to, and her name is Jen. Okay, now we got Jen who's going to give us a tip.
Hi, I'm Jen. I'll be the registered nurse in your room. I'm going to come out and talk to you before surgery and ask you a whole bunch of questions that everybody else has asked. And then I'll bring you into the room and help you get put to sleep. And then I'll make sure everything stays sterile and safe while you're asleep.
Yay, thanks Jen. At this point, we're going to skip over the operating room because this is going to be in our next clip. This, by the way, is a teaser alert. Watch our next clip. Okay, so now your operation is over and you're starting to wake up, and what they're going to do, the anesthesia doctors and the nurses are going to take you from the operating room to the recovery room, which is a special place with really good people, very observant, very nice, caring people who are going to help you transition from being basically asleep in the operating room to being basically awake, so you can enjoy your life without the problems that you had before you went to the operating room. And we have one of these people here to tell you all about it, and she's great, and her name is Kate. So we got Kate from recovery who's going to give us a tip.
Hi. After surgery, come to the recovery room, and you have one nurse take care of you and get you warm, take care of your pain, get you comfortable, and then get you upstairs, usually in about an hour.
Yay, thank you. And we are just about to complete our journey now. Remember, we started off in the Recovery Care Center, then we went to the pre-op holding area, through the operating room. We're now in recovery room, and we're going to go right back to the Recovery Care Center. This is where you started, this is where you finish. And these guys are really excellent at getting you up and moving after surgery. Remember, you walked in here, we want you to walk out. So they're excellent at taking care of your pain and your discomfort. They want to make sure that you can walk, talk, pee, and also eat comfortably before we let you go home. And they'll transition you back to your home. A little chimney here. I have a little doggy waiting for you. Hi, Fido. And one more transitional element, which is really important, particularly if you're going to be picked up in a car like most people are, is where you should park, and Ava's going to help us with that. Okay, we got Ava with a tip for you. She works at RCC here at Crouse. Go, Ava.
Make sure you park in the Crouse garage when you come, not down the street, the one on the corner, Crouse garage.
It's a lot easier to get to. Thank you. And now we're going to do the toss to our next clip, in which we're going to tell you about the operating room. Exclamation point, exclamation point. You're going to meet some of the people that we have down there, some of our techs who are terrific. You're going to meet our x-ray guy, which is a really important part of what we do. You'll see some of the equipment that we do, that we use to take care of you. And we'll basically do a quick walkthrough so you've seen it once before you roll in there, okay? It looks like it's pretty complicated, but in actuality it all fits together and we all work as one team. So here's the toss to our next clip. Okay, here's a shameless plug for our other media. We have a web page called CNY Spine Group.com with all kinds of good information, particularly if you're going to be one of our patients. We have a really active Facebook page, including a bunch of tips from patients who've had surgery. So if you're interested in seeing the experience of somebody who's already had that, that's on there. We have a YouTube channel, CNY Spine Group, which has a lot of my rants and some pretty interesting information. And recently we've taken to Twitter, where we do all kinds of fun stuff and you get some of my micro rants. So please check us out on our multimedia, and we will see you in any or all of those places. Thanks, and see you later.